It is my pleasure to introduce UC San Diego Chancellor Pradeep Khosla, who has led the campus since 2012 and who leads the multifaceted response to the pandemic that has allowed us to safely return students to campus, partner with San Diego County and school districts. Chancellor Pradeep K. Khosla is an internationally renowned electrical and computer engineer, recognized for his seminal contributions to secure software and intelligent robot systems. As UC San Diego's Chief Executive Officer, Khosla has positioned the institution to define the future of the public research university by activating the institution's first ever strategic plan and launching the Campaign for UC San Diego, an ambitious 10-year, $2 billion endeavor aimed at transforming the university physically, culturally, and intellectually. Under Khosla's leadership, UC San Diego has expanded college access and affordability for underserved students, initiated campus-wide interdisciplinary research initiatives to foster collaboration and solve societal challenges, and strengthen university and community partnerships to drive regional impact. UC San Diego's response to COVID-19, called the Return to Learn program, has made national headlines for its many innovations, ranging from COVID-19 tests in vending machines, hundreds of wastewater testing sites across the campus, and partnerships to launch vaccine super sites. Chancellor Khosla, thank you for joining us here today, and thank you for your innovative leadership during these unprecedented times. To start, can you please tell us how the early plans for formulating the Return to Learn strategy came together?
Thank you, Dean Pogliano, and I really appreciate you inviting me for this conversation. And as I think about how the early plans came together, I cannot help but counting the number of months we've been in this pandemic, and it is nearly a year. I think it was around March 11th or something like that I put an order out to send the students home. And the plans for this started about a month or so before that. I was talking to Chip Schooley, who, for people who don't know Chip Schooley, is one of the leading infectious disease people on our campus. And he's also part of the administration dealing with international students. So we were just chit-chatting, and he talked about this virus being a potential problem, and it could lead us to close the campus completely and shut our operations. And that scared me a lot. I mean, I was very concerned by that statement. And the more I thought about it, the more I realized that if we were to get ahead of this, we could actually be operational while keeping our community safe. So that's how it all started in that little conversation in my office.
What made it possible for UC San Diego to be the first university in the nation to announce such ambitious plans for repopulating university campus as safely as possible?
I think what made it possible was my understanding that we had just about every specialty that was needed to address this problem right here on campus, number one. I knew we had a very collaborative faculty who would cross boundaries very seamlessly. And I just made sure that money and resources were not going to be an impediment. So I promised myself early on that we're not going to use money as a reason to not do the right thing. And once I had all of that in my head, I was now a free person to start making bold promises and moves, betting 100% on my faculty to deliver without even knowing whether they would or not. But, it worked because that's the confidence a chancellor needs to have in his faculty.
That's great. So why was it important to bring together experts from so many different areas? You still work with people in infectious disease, modeling, bioinformatics, and student affairs, and biologists. So why were all these people important for the response?
So I have to tell you, it was not clear to me that these people were important for the response up front. But the more questions I asked, and people who work with me know that I have this bad habit of asking too many questions. And I do that partly to learn more and partly to force people to think a little bit differently. And the more questions I asked, the more I realized that just being an infectious disease person was not going to be good enough. So, for example, I was talking to Chip, and I said, how do we know how does a virus propagate? And at that time, remember, it was more like a surface propagation model as to that's where the infection was staying and traveling. Well, I said, okay, I get that. But between me, the human having the virus and touching a surface and somebody else coming and touching the surface, what does that population propagation look like? And Chip says, we have this great faculty member, a young faculty member whose name is Natasha Martin, and she's one of the best modelers. So I said, okay, let's bring her in. So then I had this question about, okay, so it's on a surface. So how long does it last on a surface? What do we know about that? So if you just think about me and Chip and others thinking about this as a research problem, we kept on asking questions, and that led to adding more and more and more people to this team.
That's great. Thank you. So one of the most striking aspects of the campus response is exactly this large team of experts that you brought together that don't typically work together. As a leader, how did you bring these individuals together so productively?
Look, I think part of it was luck, but I think part of it also was the DNA of this campus, which is all about collaboration and problem solving. And I think part of it was the urgency of the issue and the importance of the issue, where everybody felt committed to really address the issue rather than grind their own axe. So that's where I think I lucked out. And I did this in a slightly unorthodox way, where we would have these meetings on Zoom with 50, 60, 70 people in the meeting. And it was more like a research lab meeting, if I just look back now. And Kit, you were involved in these meetings, where everybody could ask questions and answer, and we would have give and take. And then in the end, we would have some sort of a directional answer, which we would then refine later on, right? So it worked out really well. And going forward, I'm thinking, maybe this is a better way of organizing solutions to issues where the problem is not defined up front completely, where the evolution of the definition keeps on happening over time, and the team keeps on changing and morphing over time, adding more people, not adding, deleting some people, that type of stuff, right? In this case, we only added people. I think like today is a COG meeting. There's like 80 people on the call.
Yeah, I've really enjoyed those meetings. One of the things that's really interesting is the kind of flat structure. People are from all different levels of the institution with all different levels of expertise, and you never know where the productive question will come from.
And we added people, so for example, when everybody was thinking this is surface transmission, our faculty, Dr. Kim Prather and also Dr. Chip Schooley, started talking about, no, it doesn't make sense. It is more aerosols, it is more air transmission. So even though the CDC had not opined, the WHO had not opined, my view is my faculty have opined, so I'm going to listen to them. So I brought Dr. Prather to be part of this conversation. And it only enriched the whole conversation, forced people to think slightly differently. And the same exactly, at one point, we did not know much about air circulation and the issue of air circulation. And you, Kit, posed the question. And then we had people working on air circulation, air modeling airflows.
That's been incredibly informative as well. So thank you so much for your leadership throughout this time.
No, thank you for your leadership. I think without you, the other deans and the faculty, we would not be where we are.
So why was it important to have a foundation of 3 pillars for return to learn? Viral detection, intervention, and risk mitigation.
Looking back, it looks like we had thought this up front. But as I look back, and I'm trying to be honest, I think this also evolves. So as we thought about everything we had done, and we said, okay, now how do we categorize what we had done into the strategies we were following? So clearly, if you want to manage a pandemic, you got to detect the virus. You got to understand where is it traveling, how far is it traveling. You got to figure out how do you stop the travel, right? Which is some combination of intervention and risk mitigation. And then you got to bring all the technologies into play So we were, for example, the first one back in April when we announced wastewater testing. Nobody knew what it was. And folks, including Dr. Rob Knight, said we can do it. And my view is if my faculty tell me we can do it, then I'm just going to bet on my faculty and I'm going to double down on those bets. And there we were. And Rob Knight actually delivered.
Great. Can you please tell us about some of the innovations that allowed Return to Learn success?
I think Kit, there are many, many innovations. Clearly, wastewater testing was one of them. Clearly, it seems obvious now, but the recognition that it was in the air and aerosol transmission, the recognition of that was, I think, an innovation, not the fact that the aerosol, does that make sense? I think the recognition that airflow might have some role to play in mitigating the risks in congregate settings. And then at some point when we were going from hardly any capacity, 200 to about 5,000 or 6,000 a day, the innovations, which actually people don't talk about, I realized that the federal government at that time could cut off our supply chain anytime they wanted. And they were actually doing that. They were hijacking supply chains. So we had like 4 different supply chains established. We had Illumina, we had Thermo Fisher, we had multiple ways of doing this. We had saliva testing, we had nasal swabs. So we had like 3 or 4 different supply chains established so that they could not take all 4 away. So they could take 1 or 2 away, which would diminish our capacity, but they could not bring this operation to a halt. Now, it looks like we were not trusting of the bureaucracy that exists. The fact is, we were not trusting of the bureaucracy that existed then on the outside, because they were actually trying to mess with this operation. And my goal was to keep my community safe. So the other innovation that, so at one point we went from twice a month testing to once every week testing. And we realized that the issue of access was problematic. If every student had to make a phone call or go to a website, it would not work. It would not scale that easily. And being an engineer, and especially an IT person, I know that when you want to scale something fast, you got to bring the friction down to 0. And the best way to bring the friction in this case was picking up the phone call, going on a website. So we did this vending machines. Somebody had this idea and we said, let's do the vending machines, So now we have vending machines. Nobody schedules anything. You just go swab yourself and there we are. So we connected the ability for a self-swabbing test with the vending machines and put it all together. So none of this was a plan at t equal to 0. All of this evolved over time.
Yeah, it's really, really neat. Do you have a favorite innovation or something you consider the most innovative aspect of Return to Learn?
Look, I think there's many, many innovative aspects of Return to Learn, but I can tell you what to me was the most surprising aspect of Return to Learn is a different way to think about this. When we were thinking about this, the community was saying, wait a second, you're going to bring 10,000 students here, and these people are not going to behave properly, and they're going to make us all sick, and you're just going to hurt the community, which actually was very concerning to me, including some of our students and faculty and staff signed up for this type of rhetoric. So I had to think very deeply about this, talk to many people. In the end, we did bring about 10,000 students back. And what was most surprising to me, partly because of our strategies, but partly because of their commitment, was the behavior of these students. So the single biggest determinant of a system falling apart, whether it's cybersecurity or pandemic, is a human being. And in this case, the human being, being our students, behaved very well. Our Vice Chancellor for Student Affairs, she ran a spectacular operation, motivating them to behave well. We had multiple things happening where we had health ambassador program. These were peers who would walk around campus watching for people not following protocol. So if you were wearing a mask, suddenly you might get a $5 gift card for Starbucks. If you're not wearing a mask, you would get a little tap on your shoulder saying, please wear a mask. So it was all peer operated, peer pressure, people working with each other to secure everybody. So that was actually an innovative aspect. And as we are in this pandemic right now, so we have told everybody that if you test once a week for 10 weeks in this quarter, we will donate $50 on your behalf to the food pantry and other needs for the students. This gives them a good motivation to really help their colleagues, their peers who need help by just behaving better. And guess what? We are seeing a lot of uptake on this.
Fantastic. Looking back, would you have done anything differently?
I don't know. I don't think I would, to be honest with you. I know the right answer is yeah, I would have. But I have looked back. And even though if I knew the whole problem, this is not the way one would solve a problem. But the more I've thought about this, it seems to me that every problem keeps on evolving as we learn more and more. So I would create a dynamic solution strategy the way we had here, where the group starts off as a small group, then it keeps on expanding depending on the needs and the issues that arise in the problem statement and our understanding of the problem. And they just get integrated, and we keep on, as they say, build the plane while flying it. And it has worked really well. I know it sounds counterintuitive to build a plane while flying it because it should not work, but in this case, it did work. We solved the problem while the problem was evolving.
Well, you have a virus that is evolving, and therefore the response needs to
Right,
evolve.
and our understanding of the problem is evolving. And if you just take a step back and think about, that's exactly how we, as faculty members, do our research. Because that's how we keep on evolving our understanding and the definition and keep on addressing different branches that arise in the problem.
That's great. Thank you. Looking ahead, with UC San Diego playing such an active role in the region's vaccination strategy, what's your message to those unsure about getting vaccinated for COVID-19 or those frustrated because they can't yet make an appointment?
So my message is very optimistic. It is to be patient. I know it's easy for me to say that, but we have been in this for a year now. I think as I look at the situation right now, by mid-April, we should have a lot of vaccine availability. And we're already moving from Tier 1A to 1B. The websites are becoming better and better. We are starting more our capacity. So as we speak right now, our Petco Park was closed for 3 days because we had no vaccines. So now we are at a point where it's not the vaccine, it's not our inability to deliver the vaccine, it's our ability to get vaccine delivery, right? So once we have more vaccines, I think we'll be in good shape. REMAC is open now. So I'm very bullish about where we are headed. And I think UC San Diego, and for that matter, any public university, an R1 public university with this capacity, should be playing an important role in helping the community become more secure and safe.
That's great. Well, thank you. Thank you so much for your leadership and for making UC San Diego the resource to the community that we need to be. It's really been a pleasure participating in this process, just even peripherally, and I feel lucky to have you as Chancellor.
Thank you, Dean Pogliano, and I feel fortunate to have you as one of our deans. And let me just say a big shout out to our faculty. They were amazing in the way they collaborated, and most of all to our students. I mean, without you, we could not have done it. Because of you, we exist, and without you, we could not have done this, managed this pandemic. So thank you very much.